In that segment tonight, according to the federal government, drug overdose deaths surging, especially among those using opioids like heroin and pharmaceuticals. Last year, more than 33,000 people died from using opioids, including nearly 13,000 who OD'd on heroin. By comparison, gun homicides in the USA killed nearly 13,000 people, traffic fatalities 32,000. Some believe the reason for all that hard drug use is that the Obama administration has played down the danger.
But here's the thing. Over the last few decades, we've also locked up more and more nonviolent drug offenders than ever before for longer than ever before.
Mr. Obama believing those who sell heroin, cocaine, and methamphetamine are not committing violent acts, even though the poison they sell is obviously killing tens of thousands of people every year. That message from the president has gotten through, and many in this country, it's not a big deal anymore to become involved with hard drugs. Also, as you know, there is a move to legalize marijuana all over the nation. Over the weekend, I saw an anti-cigarette smoking commercial that was devastating, showing the horrors of what tobacco can do to the human body. Very effective ad. But where is the anti-marijuana ad? Where's the message that intoxicating yourself, even with a soft drug, it's not a great thing? Those ads don't exist because the media largely glorifies marijuana use. And if you think that hundreds of thousands of people have not graduated from pot to hard drugs, you're an idiot. They have. So what we have in America is a soft policy toward hard drug involvement. And that's why drug overdose deaths are surging. Or am I wrong? Joining us from Washington, Charles Krauthammer. And you say?
Well, I think you're generally right. And although as much as I would like to lay every social ill in the country at the feet of Barack Obama, I'm not sure this is an act of commission on his part. It's more an act of omission. I think Obama simply reflects the zeitgeist, the general feeling over the last 10, 15, 20 years that drugs are a personal choice, that we should destigmatize it. I think he's right. You don't want to lock up marijuana users. But I'm not sure that we're doing that anyway. I think that's an excuse.
They're not.
I think the real issue is, you know, in the 1980s, we had a first lady who unashamedly, she was laughed at by the sophisticates in the media, but unashamedly, she had a campaign, Just Say No. In other words, it's very important to stigmatize certain things. And when you destigmatize certain things, you get more of it. For example, you know, when we were growing up in the 50s and 60s, single parenthood, illegitimacy was considered something that stigmatized you, and there was a social norm against it. You can do all you want with laws, but when social norms erode, then
that's right.
things
That's
change.
Exactly the way I feel about it. And you're referring to Nancy Reagan on the Just Say No thing. You didn't mention her name. But here's the deal. President Obama has made it a cause to go out and try to convince Americans that, number one, selling heroin's not a violent crime. That's insane to me, because I've seen what heroin does to people. All right? And number two, he does this because he believes that the justice system is unfair to black heroin dealers, see, because more of them are arrested, the black heroin dealers and the crack dealers who are out on the streets, who are actually peddling on the streets and are easier to arrest. He sees this as a racial thing. So he's tied the racial thing into his permissive attitude about narcotics. And what do we have? An explosion of heroin use. Kids wanting to try it, thinking it's cool. And that comes from the top, the leadership of this country. So it is his fault.
Well, look, you're not going to get me to go there because I think that's an exaggeration. Look, let me give you an example. The spread of the number of states where marijuana is now legal, that has nothing to do with Obama. You can say he should have been crusading or he should have been making a case against it. But the fact is, he had other priorities. He wasn't particularly interested in that issue one way or the other, and he reflects the left liberal view of allowing people to do their own thing. The problem is that when they do their own thing, they often end up dead, like with heroin. On the crack cocaine thing, I think the racial part was that crack tended to be more in the inner cities, and there was the idea that they were getting treated more harshly by the legal system than people using other forms of cocaine.
Because crack was a violent industry. It was run by people who were destroying neighborhoods, whereas the powdered cocaine was up the noses of these Wall Street idiots.
Exactly.
Okay? So the public health crisis was in the crack precincts, as we saw here in New York City. But I'm surprised you're giving Obama a pass on this. The two big things that he did, blunders, was ignoring the rise of ISIS and enabling it by withdrawing our troops in Iraq. That was a blunder almost beyond compare. And his laissez-faire attitude about, hey, you know, hard drugs, you want to go deal them, go deal them. You know how many people, we gave you the stats on the dead people, 34,000. You know how many people are enslaved, have AIDS, are prostituting themselves, families ruined, and this guy doesn't care about it? He doesn't care about it? Give me a break, Charles.
There's one other thing, one other factor that you may not want to recognize because it hasn't anything to do with Obama, and that is that in the late 1990s, doctors began prescribing legal opioids.
I know.
No, but this is not a trivial thing. You have got millions of these pills sitting in the cabinets of houses all over America where kids and the adults get addicted, and kids also, they find them, they trade them, they get hooked.
Well, at least they're doing something about that.
Once you're hooked on the opioids, once you're hooked on the drugs, you end up in the street buying heroin.
Yeah. All right, Charles, thank you. Good debate.